Your thigh won't stop burning. Your doctor doesn't know what's wrong with you. You've even had a spinal MRI and it didn't show anything. Then this video is for you. There's a nerve called the lateral femoral cutaneous nerve of the thigh that passes through a ligament here in the hip area. If you stand for a long time and your thigh starts burning or tingling, and if you feel relief from this symptom when you lie down, there's a chance you might be experiencing meralgia paresthetica syndrome. Now I'm going to give you 4 tips to help you solve this problem without surgery. Tip number 1, avoid tight clothing. That's right, some patients are actually responsible for the meralgia paresthetica they have. By wearing tighter jeans or a new belt that's squeezing your waist, you compress this nerve, and that's when the symptoms start. If you notice that any clothing is squeezing your waist too much, especially if you've gained weight, pay attention. The first step is to stop wearing those clothes. The second tip is stretching. That's right, nerves like movement. If they're being compressed somewhere, and you try to stand for a long time, that will end up causing friction and the symptoms that bother you so much. So, stretching your thigh and hip helps to release the nerve in the area where it's being compressed. And then you may see an improvement in your symptoms. Tip number 3, which really helps along with stretching, is a warm compress. You know those compresses you heat up in the microwave and then place on an inflamed area? Exactly. Heating up a compress and placing it on the area where the nerve is compressed, which is the hip region, really helps to release that nerve. And right after using the warm compress, you can continue with your stretching more easily, especially on cold days. Lastly, massage. A massage with myofascial release in the area where the nerve is compressed can be extremely helpful in releasing that nerve without surgery. Therefore, the tips we're giving here are conservative options, without surgery. And here's another tip, which is a routine you can use throughout your day to get the best results. What I usually say is this: you start with a warm compress on the area to relax the muscles more effectively. Second, you do stretching for your thigh and hip. This will help the nerve become a bit less compressed. And finally, massage, so you can be even more effective in releasing the lateral femoral cutaneous nerve. Follow these tips and do them one after the other every day. You may notice a big difference within the first few weeks. Attention! These tips will solve the problem for more than 90% of patients within 6 months. However, if you are a patient who, even after doing all this and physical therapy, has not had good results, pay attention. You may need a slightly more aggressive treatment to improve your symptoms. Remember, paresthetic neuralgias have better outcomes when treated within less than a year. If your pain lasts longer, the chance of having a poor outcome is much higher. You may have noticed that there aren't many videos about paresthetic neuralgia on the internet. If you want me to produce more content to help you get better from this problem, be sure to like this video and follow our channel.